And welcome back to Public Health Matters, a show where we talk about matters in public health. My name is Jane Goodman, and I'm a communications specialist with the Division of Public Health and Community Services. Welcome back to all of you. We'll start today's program with a general COVID-19 update because we really want you to understand what's going on in our own area and in the state and globally, of course. So this week, globally, we have 22.7 million cases, and we've unfortunately reached over 4,000 deaths globally. In the United States, we have 5.6 million cases and 174,000 deaths. In New Hampshire, we have 7,050 cases to date. This information was updated this morning. 90% of our cases have recovered. 10% of those cases were hospitalized, and unfortunately we have a 6% case fatality rate in New Hampshire. In Hillsborough County, we have 3,891 cases and 280 deaths. Overall, we have a 2% positivity rate, and that is a 7-day rolling average. So we want to know what are the numbers of positive cases overall from the tests given. We feel very happy with this rate. We'd love to get it even lower, but right now at 2%, it fell to about 1.3% during the week. So that was really exciting to see. The lower the better, of course. And nationwide, we look for below about a 5% positivity rate to really get things reopened and to continue reopening. So we're doing very well in New Hampshire, so keep up the good work with the hand washing and the mask wearing. If we want to look at our Greater Nashua area or the city of Nashua, our cumulative cases are 828. We're only up 9 cases from a week ago. Our active cases are at 18, so we're down by 50%. Great news for our contact tracers. Our contacts from those cases have dropped to 102. We've held steady with 41 deaths in the city of Nashua. We have a 98% recovery rate, so that's great news for us that 783 of our cases have recovered, an 11% hospitalization rate, and a 6% case fatality rate. So overall, we're doing really well in Nashua. If you would like to get a COVID test, please remember that we do have a weekly clinic. It is on Tuesdays from 3 to 5 p.m. It is at the Elm Street parking garage, which is the parking garage right behind City Hall next to the bus shelter. It is a drive-through clinic, but if you do not have a vehicle available, you can certainly walk up to the clinic. We do ask that you call ahead. It makes scheduling much easier for us and for our personnel, and it also gets you in and out very quickly. And the number there is 589-3456. And I'll be sure to repeat that at the end of the show. So just quickly, because we are in a 14-day mask challenge for the city of Nashua, and we do have a mask ordinance in place, I did want to show you all a little mask demonstration to remind you the importance of not only wearing a mask, but wearing your mask properly each day. I have a lot of different masks here. I have this great mask from the United Way that was supplied by FEMA. And I also have our public health masks. These are both washable masks. And then I have the good old surgical mask, medical mask that you see a lot of people walking around in. This is a disposable mask. For the purposes of today, I'll just use my FEMA mask. Very important to start your putting on your mask. We say donning our mask. On your ear. We try to only touch the ear loops and not the front of the mask. So you want to start on whichever ear you choose. I'm a lefty, so I always start on the left side. You want to pull it over with the ear loop onto your right ear, and I won't keep it on long here because it'll be hard to hear. You can tuck down here just a little bit, but try to avoid touching your face. And you want to do that and throughout the day to avoid, when you're wearing this, not to touch your face, not to play with your mask. When you remove your mask, you want to, again, take it by the ear loop, bring it over, take it off your face carefully, and then as I say to my kids, it's just like underwear. You drop it in the wash at the end of the day. So you should wash all your masks. So some other public health announcements. The public health building, our offices will be moving next Friday to the Landmark building. That's on 142 Main Street. Because this is a rather large move for us, We will be closing our offices on Friday the 28th and Monday the 31st. This move is important for us. We're having a year-long renovation of the Mulberry Street building so that we can serve the community a little bit better. New fresh clinics and other office space so that we can provide even better service than we do now. We will be back open for business on Tuesday, September 1st. And finally, in regards to last week's show, we talked to the Picker artists, and they have launched their sculpting, and you can go see that on Pine Street, and that will be through September 12th. So please support them and the beautiful work they're doing for our community. So today I have a very special guest. We always have special guests. I have Joe Manzoli from the Nashua YMCA, Nashua Merrimack, or the Greater Nashua.
It's the YMCA of Greater Nashua.
Okay, yep. The name has changed yet again. Joe's the Chief Operating Officer, and you're joining us to talk to us a little bit about what the YMCA has gone through during COVID-19, and also how innovative you've become to provide some really important services for children. So first of all, Joe, tell us what you do at the YMCA and what your responsibilities are so we can kind of understand where you're coming from.
Sure. The YMCA of Greater Nashua has 4 locations. We have our branch, our Nashua branch right here at Exit 5, our Merrimack branch, Westwood Park, which we opened last year, is just off of Amherst Street in Nashua, and then Camp Sargent in Merrimack. So throughout the year, in a typical year, we would serve about 30,000 people in various programs related to healthy living, youth development, and social responsibility. So I help manage all of those programs. I've got an amazing team all around that helps run our programs and connect with the community. And really, at the end of the day, what we do is make sure that we're meeting the needs of the community. And so throughout our history, the YMCA has been here in Nashua for more than 130 years. We've adapted throughout that time period to meet whatever the needs of the day are. And the last several months have really tested that.
Yes, definitely. So tell me, so what happened during COVID-19 back in March? I mean, clearly you must have closed.
We did.
And how long did you stay closed, and tell us?
Yeah, so we like to say they closed our facilities, but the YMCA never closed. We shifted very quickly to serving the needs of the community. So we closed our buildings on March 17th. It was shortly after the local school districts decided to shut down. We just realized that it was time for us to make that same decision. Shortly after that, we began having conversations with people in the community to find out where the needs were, and we heard very clearly from the local hospitals, particularly St. Joseph's, reached out to us and said, we need to make sure that our staff can come to work, and we need to make sure that the children of our staff have care. And so we pivoted. We have the largest child care program in New Hampshire, and so we pivoted very quickly to be able to run child care for essential workers. And the definition of essential workers for all of us expanded as time went on. That included people who worked at grocery stores and banks and public works. We needed everybody to go to work. And so we were able to offer childcare in a safe setting. We had the state guidelines, but we came up with our own protocols and procedures as well. Working with the public health department was very helpful to us during that time. So we right away started running childcare for essential workers. We also partnered with other agencies, particularly the United Way, to meet food insecurity. So we, on a daily basis, and we continue to do this with volunteers throughout the community, we go deliver food to housing complexes around the city to make sure that people have the food that they need. We also recognize that the YMCA, it's not just a place to go work out or go swimming. It's for many, it's a social space. It's the place where they connect and gather with others. And knowing that we couldn't do that anymore, we were concerned about loneliness. So we started reaching out to seniors. We were making phone calls to our seniors every day. Many of those calls went on for 45 minutes because they were very happy to hear from us.
So you're definitely busy.
Absolutely. We also did a lot of virtual programming, which we put out for free to the public. That's still on our website. We called it the YMCA Beyond Our Walls. There's exercise classes and kids' science classes and art projects that we continue to do. So we just continued to look at where we could meet needs. We hosted blood drives. Blood drives all around the country were canceled in those early months, and there was a severe need. So we worked with the Red Cross and the local hospitals to host a couple of blood drives at the Y, because we felt confident that we could do so safely.
Oh, great. So tell me, how did the child care go? I mean, that's obviously a big concern, especially as we get back to school. I mean, were there any issues with the child care, any diagnoses of COVID-19 while any teachers, students?
Yeah, I'd be happy to tell you about that. So what we did with childcare, and we continue to do in summer camp. So we're now, this summer, we're serving about 350 kids a day between camp and childcare. In those early days in the childcare program, so that was children as young as 6 weeks old, right up through 6th grade. That we were caring for. Those older kids, we were actually providing opportunities for them to connect with their teachers during the day with remote learning. We looked at how we could create a contactless drop-off and pickup. So as parents came in, we had one entrance to the building. Everybody in the family that was coming in, we tried to limit that to just the children and one adult, had their temperatures taken. They answered a questionnaire each day, and then they went to their classroom. They did not enter the classroom. The children would go in, the teachers would be there to greet them. Our class sizes were smaller than normal, so we were maintaining a group size capacity of 10. So in most cases that was eight students and 2 teachers in each classroom. And what was key for us and continues to be key for us is keeping those groups together all day. That's a challenge for us. We're open from 6:30 in the morning until 6 at night. And so what that meant was we were staffing those rooms all day. So because we couldn't have, all the kids who arrived early in the morning show up in one room, and then we split them back into their normal rooms. We had to keep them in their regular groups. And so by doing so, it made sure that if and when we confronted a positive case, we knew exactly who that affected. And so we've had, in our child care program, we've had one positive case related to the program. It was a parent of a child. And those systems that we had put in place really came to the forefront because we knew that it only had any impact on that one classroom. Okay. So we worked with the public health department who started the contact tracing. The children in that classroom were asked to stay home for a period of time, as well as the teachers. Nobody else in that room ever tested positive, and they all returned. But we didn't have to shut everything down because we knew exactly who might be affected, even though it ended up being that nobody was affected with a positive test. Having those pods that we hear so much about has been so critical in making sure that we can continue to serve those families. And the families that were in that classroom all handled it very well. I mean, everybody knows the environment that we're in, and so they understood and were able to work with us on that.
And did they stay home for 14 days, or is that what you used for your benchmark?
Yeah, they stayed home. So we had, again, worked with the public health department as well as the Bureau of Infectious Disease at the state level. And so what was great for us is, and we had spent a lot of time early on in March and April, really discussing, when we reopen our facilities and now that we're running childcare, how are we going to handle a positive case? And I invited Bobby Bagley from the Public Health Department into one of our meetings through Zoom. And Bobby basically said, we've got you.
Right.
If there's a positive case, here's what happens. And she walked us through it. And sure enough, that's when we had that positive case, we connected with the Public Health Department and the Bureau of Infectious Disease. They walked us through everything. They got all of the information. They actually helped us draft the letter that went out to the families. They did contact tracing, which was really incredible for us to hear about from the parents and teachers who were home. They got phone calls every day, checking in to see how they're feeling, if anybody else in their family wasn't feeling well. And that just gave everybody involved a lot of confidence in our local community that we're handling this as best we can.
Yeah, well, that's great to hear because our contact tracers work very hard, and they spend a lot of time on the phone checking up with families. And it's nice to hear that there was a system in place that really worked and worked for you. And then similarly, we were talking a little bit before we went on air that you had the same thing happen at Camp Sargent.
Correct.
And no alarm bells went off. You handled it in a very similar fashion. And the camp stayed open.
Yep.
And I bring these to light really, Joe, so that people understand as school goes back into place that there is a plan, and that the nurses, the contact tracers, public health, and the school administration, the YMCA, all of these places that are providing services understand what to do, so that we're not closing things down because there's one positive case. We're being cautious, and so
and what we've learned is, and we've talked about this, is that we can put in systems in place to minimize risk, and it's really so we're checking temperatures of everybody who comes into the YMCA, and there's some people who will say, well, that's a lagging indicator. You can have COVID and not have a temperature. We understand that, but it's a layer of risk reduction, as well as wearing masks, as well as washing your hands, spacing out equipment, or keeping classrooms together. And so I think for all of these organizations and businesses that are figuring out where we go from here, it's coming up with those systems of risk reduction, as well as us as a community doing what we're supposed to do. You talked about wearing a mask earlier. I am so happy when I walk around and see other people wearing masks.
Me too.
And get frustrated when I see others that don't.
Yeah.
And I get it, especially in the summer, it can be difficult. But gosh, if we all do what we're supposed to do, it doesn't mean that no one's ever going to contract the virus. But if they do, we're able to control that. And I think that's when the numbers you shared earlier, I think speak to that New Hampshire, our local community, even the greater New England region seems to be, from my uneducated eyes, be handling this well, and it's partly because we all play a role in the public health.
Right, you see it. And I've been down to Boston, everyone wears a mask. They're walking their dogs wearing masks. Right. So they've really gotten their numbers down as well. So it is a community effort. So I appreciate you giving us the plug, and also the kudos to our contact tracers who are working really hard to contain this and kind of, as Bobby would say, cut it off at its knees. Yeah. You've reopened at the Y. My burning question for my teenager is the gym open, and can you use it?
Yes, you can. So we reopened on June 3rd, and we had been planning all along. We kind of assumed it might be early June, just the way things were reopening. And it was funny, and this is a good example for everybody that, the best laid plans. We had plans in place based on what we thought we'd be allowed to do. We had seen an early draft from the state guidelines, and then the guidelines came out, and it was literally the opposite of what we anticipated.
Oh dear.
So we had to pivot, and I think all of us, we have to adapt quickly to these circumstances, and that will continue. I mean, it feels like we're all kind of sort of getting back to somewhat normal. We have to continue to adapt. So we reopened on June 3rd, and there's been a few kind of phased reopenings of that. But the current environment at the Y is that really anything that you would normally do at the Y, you can do now. Just maybe slightly different. So if you're going to the Y to exercise on a treadmill, you can do so. You can come in right after we finish this interview. You could head on over, you wear a mask when you arrive, and anytime you're in the building in any public place, you'll wear a mask. When you're getting on the treadmill, you don't have to wear a mask. We have all of the equipment spaced out, and we kind of rotate out which pieces we're closing down each day, just so we're able to track that. We ask that every member wipes down their equipment before and after use. And then we have a flag system. So we have these yellow flags that are draped over the back of each piece of equipment. When you're done, after you've cleaned your own piece of equipment, flip the flag back over, and our staff will come over and clean it again. Yeah. So that's in our exercise area. People who want to swim, they can make a reservation. Our lap swimmers are loving it because they have a whole lane to themselves. Right. So they are really enjoying that, and they know that they've got that lane. A lot of our lap swimmers will stress out if they go at a busy time. Group exercise classes, yoga, Zumba, all of those classes, we're still running, just doing it with a reservation system, and where we can, outdoors. So we've created kind of a nice little outdoor studio that's been really well received, and some of these things are things we'll continue to do moving forward. Right.
It's interesting how, we say we pivot, but some of these things we probably really like being outside to exercise and, and cleaning the equipment, which we probably should have been doing much more before COVID-19. So now we'll hopefully keep that up. Right. But you always have to have all these new systems in place, your flags and that kind of thing. Yep. So the real reason we brought you on here, Joe, although this has been fabulous, is to talk about the Nashua Y Educational Academy that you guys talk about pivoting, have pulled together really out of need for those students that are returning to school where parents have to work. Correct me if I'm wrong. There's going to be a lot of remote learning starting in the fall. Parents need to get back to work. And you have created this program at the Y, which just sounds phenomenal. Tell us about it.
Yeah, we're really proud. So we've created the YMCA Education Academy in a response to the needs of families as we go back to school this fall. We have tremendous relationships with all of the local school districts, particularly here in Nashua. We do a lot of programs with the Nashua School District, and we've been in communication with them throughout the spring and summer to just get a sense of what they were thinking, as well as connecting with other school districts. And it was starting to become more apparent that school was going to look very different, and whether that was fully remote or some kind of hybrid, we knew that there would be days where kids would not be in school. And as we all saw back in the spring, parents and guardians need to go to work. And the school districts understand that. They've done a remarkable job trying to navigate this. And so, as I said earlier, we're the largest childcare provider in the state, at least. And it's what we do best is youth development and nurturing the potential of every child. So we wanted to create a program that ensured that parents felt confident in going back to work, knowing that their kids were safely cared for, while at the same time supporting our partners in the school district and making sure that these kids, helping kids do whatever remote learning that they need to do. So what we've done is created a full day program that to start the year off, we're going to run at Camp Sargent and Westwood Park, and I can explain why in a second. Those will be full day programs. We'll have enrichment activities, so in a lot of ways it'll feel like summer camp, but we're going to have times built in during the day where students can log in and do the remote learning that is required by their school. And we're going to be serving kids from 7 or 8 different school districts. And so we're going to make sure that we understand what the requirements are for each of those school districts. In addition to ensuring that they're doing their remote learning, we're bringing in our own curriculum through a partner of ours called Bell Excel. There's a curriculum where we'll enhance the learning that's happening remotely with our own curriculum that focuses on literacy and math. This is something we do in the summer with the Nashua School District. So we want to make sure that these kids are not just doing the bare minimum and keeping up. We want to help them succeed even more as they go back to school.
And it gives them some socialization too.
Absolutely, yeah.
Really craving, probably, having been home, you know.
Yeah, we
March.
saw it early in the summer when we started summer camp out at Camp Sargent. You could see on the first day, kids were getting out of their parents' cars, and they were just, it was a little weird for them, right, to be back in that environment. And so that socialization is critical. And because of what we've learned since March, running essential childcare and now summer camp, we feel confident in our ability to do this in a safe way. Again, nothing's ever going to be 100%, but all the things we've learned in terms of keeping kids in pods, doing this remote drop-off and pickup, or I should say contactless drop-off and pickup, and all of the other things we're doing to keep the facilities clean. We've quadrupled our housekeeping staff at the Y to make sure that the space is clean. We believe that all of those things will go in to make sure that the kids and staff are as safe as possible, and that when they are going back out into the community, that we're keeping the community safe as well. But what's really critical is that those parents can go back to work knowing that their kids are safe, and also knowing that their kids are continuing to learn, so we can support, because the schools are doing their best, and if we can help them with that remote learning, because I know that'll be a challenge.
Yeah. So I read that it's flexible. I don't have to sign up as a parent for all 5 days. I could do 2 days. If some offices are doing a hybrid model as well, you can work from home some days, but there are days where you really do need to be in the office. So can I sign up for just 2 days, or?
Yep, you can sign up for 1 day. So we've set it up, and this is new for us. We typically wouldn't do this, but we have a daily rate. So you sign up for the days that'll work for you. And we did that because we know in some of the school districts, so in Nashua, they're all going to be remote through September. Merrimack is going back in September, but they're doing a hybrid where students will be in school for 2 days and remote for 3. And so we know everybody's needs are going to be different. And in some cases, parents are choosing to go remote, but putting their kids in our program because it's easier for their schedule to not have to figure out what days am I going in, and this might be an early release day. So we've got a lot of flexibility in terms of when families can register.
Great. And I noticed that it was $40 per day. Is there any financial assistance available if that's not attainable?
We are going to make sure that any child that needs this program can be in the program. We've been working hard to generate support in the community to be able to offer that financial assistance. So we've already been reaching out to children we've served in the past who've received financial assistance, as well as working with community partners to make sure that we can serve as many kids as we can that need this. I mentioned earlier that we're using Camp Sargent and Westwood Park.
Yeah.
We're doing that for two reasons. One is we've been running summer camps in those two locations, and so we've got really good system in terms of drop-off and pickup. Okay. Camp Sargent's outdoors. We're going to continue to keep kids outdoors as long as we can.
The good old outdoor classroom.
I like
exactly.
That. It's going to be a lot of fun. And then Westwood Park is, again, that's our newest branch. It's a big open space. It was a sports facility when we acquired it. So it's a big open space. There's some outdoor space there as well. We just felt that that was the best space to start off with. As we get further into the fall, we'll move the kids who are at Camp Sargent. We'll move those kids to another location, most likely the Merrimack branch. And while we're operating in those two locations, it's not. If you live in Nashua, you have to go to Westwood Park. If you live in Merrimack, you have to go to Camp Sargent. Anyone can choose to go where they choose to.
So it's flexible. Sounds like a great program and really supporting families in Nashua. So thank you for doing what you do, because I think we do want to get back to whatever the new normal is, and gradually. So hopefully it'll really fill a lot of needs in the Nashua community. You mentioned that you have about 180 families signed up right now, but you have capacity for? There's still room left.
Yeah,
there's room. I want to let people know.
About 325 is what we think our capacity will be, and that can change depending on the state guidelines on group sizes actually just changed, so we might be able to serve a few more than that.
Okay, great. So how do we sign up? Sign up online, call the Y?
Best thing to do is go to nmymca.org, and right in there you'll see information on the Educational Academy, and you can register online. It's very easy. And if you need financial assistance, you can reach out to us directly. Okay, great. So nmymca.org to sign up. Thank you, Joe, for joining us. My pleasure. I hope that this works out for the fall. It sounds like a terrific program. And thank you all for joining us today. We're going to be finishing up here. I just want to remind you that we do have a COVID-19 testing clinic every Tuesday from 3 to 5 at the Elm Street parking garage. You can call 589-3456 to make a reservation. And we will see you next week. Stay healthy, enjoy the weekend, and drink a lot of water. Bye-bye.